Hi, it's Dr. Shirlea North from North Star Physical Therapy, and thank you for joining me for today's episode. We are going to be talking about some new terminology or newer terminology in the pelvic health field, and I just want to try to get out there to help spread the word on it because it's a much better term for certain symptoms that for those that are born with the vagina and go through the hormonal changes of life, what we experience around perimenopause and postmenopause, as well as right after giving birth. The terms are genitourinary syndrome of menopause and genitourinary syndrome of lactation. So luckily the last two words of each of those terms give you an idea of the time frame of when these certain symptoms occur. But I just want to break it down really basic, elementary level. What the hell am I talking about? So for those that have experienced urinary changes when when our hormones are adjusting around that perimenopausal time frame, this can happen a good decade before menopause. Okay, so that's where the terms of perimenopause and postmenopause is literally the day after you have gone at least 12 months with no cycle, with no period, no bleeding. And that typically happens on average right around 51 years of age. Genetics play a huge role in this, but a lot of symptoms perimenopause, the time around when this hormonal change is happening, can happen up to 10 years prior to that day. Some of these changes is because our estrogen level, our estradiol, that's primarily produced in the ovaries, it starts to go down, but also progesterone starts to dramatically go down, and estrogen is just trying to help out. Wait a minute, we're not ready. So there's these like ups and downs, up and down, and fluctuations on top with the slowing down of having a menstrual cycle. And so that's when menstruation can become counting more fast. It can get heavier, it can get lighter, it can be a shorter cycle, it can be longer cycles. But once you go 12 months without having a cycle at all, that's when we are menopause. Okay, pause. It's like it's done. But there can be other symptoms because estrogen is everywhere in our body. Some major symptoms are urinary incontinence, urinary urgency, urinary frequency, as well as vaginal dryness. Now, the term before was vaginal atrophy or geriatric vagina. How horrendous are those two terms? It's, wait a minute, when I hear the word atrophy, I'm thinking like shriveled up and it goes away. If you don't use it, you'll lose it kind of thing. I think of like muscles. The muscles atrophy. If I'm not using it, it's going to get weaker. But that isn't the case for the vagina. The canal is there, okay? And it doesn't atrophy. It may get a loss of lubrication because estrogen helps with that lubrication and the blood flow to the area, but it doesn't like shrivel up and die. And there are symptoms with that reduction of estrogen and reduction in the blood flow, and that's where we get some of these urinary symptoms as well. So having the new term genitourinary syndrome of menopause gives a wider breadth of those symptoms, and that is very common, okay, to occur. And that's whenever, as a pelvic floor physical therapist, I am often talking about these symptoms because I see a lot of those individuals within this time frame in their mid to late 30s, early 40s into their 50s, and we're having the mood changes, maybe some hot flashes, visceral or abdominal like weight gain, and a whole host of other symptoms of menopause and perimenopause, but no one relates that to what's going on down there in their pelvis. And it is so very common. And so whenever I do an external and internal pelvic exam, I'm always looking at these vaginal bulbar tissues just as a tissue integrity check, but then also to help educate, there's something we can do about it. And let's talk to your provider about potentially some hormonal therapies, if those are appropriate for you, that are more localized to those tissues that have absolutely no risk of blood clots, or cancer causing or any systemic thing like that, because it's very localized application of that hormone that we are being reduced naturally because we're going into menopause. And so a lot of times that can help solve a lot of these urinary and sexual symptoms. So if you have, for example, vulvar or vaginal dryness, pain with sex was a huge signing symptom there. A reduction of the lubrication can be we can have some pelvic floor tightness. We can have pelvic floor weakness. Again, all the urinary symptoms. We can now have some stress urinary incontinence or urgency incontinence. We can maybe be dry or continent, but have such urgency and frequency, like it feels like we have a UTI. We feel that burning, but when you go in to get your urine and analysis done, when you do one of those home kits, nothing, it's negative. But yet we get put on these antibiotics just in case. And if that test is negative, there is no infection present. It is not a UTI. You don't need to be on antibiotics, but you may need to talk to your provider about vaginal estrogen or involve our application of that vaginal estrogen. And it can be a suppository, it can be a cream, right? But we just want to make sure we are saying the right things, and having this new term of genitourinary syndrome of menopause is extremely helpful because it really, again, covers the reproductive symptoms that we get, as well as like the urinary symptoms that we get. So to piggyback that, there's genitourinary syndrome of lactation. And so for those that are pregnant, when you deliver, progesterone drops, estrogen drops. For those that are able to breastfeed, the oxytocin and prolactin help to push the return of that estrogen level. So your period doesn't really come back during that time for a lot of folks. And so it's a very similar environment for your vulva and vagina and that area and your pelvic floor as it is in menopause. It's a very similar hormonal situation that's going on. However, genitourinary syndrome of lactation typically doesn't last as long, but for however long you're lactating or breastfeeding, you don't have that return of estrogen, you can have these similar symptoms. And so there are some other topical solutions that can be done here. There's obviously being assessed by a pelvic floor physical therapist, talking to a urogynecologist, your OBGYN about these things too. You want to help rule out the orthopedic changes that occur during pregnancy and at labor first to really see, do we need to do something on top of that, thinking outside the box. But I just want to mention these two terms because I think they're just such a better way to phrase and to start using out there that really help encapsulate these symptoms that we have, our urinary symptoms and our genital symptoms within these two big time frames of our lives. Question I get all the time is, if I don't get pregnant, will I get this? And we may not get the lactation part, but you most certainly may get the menopause part, because that 100% is going to happen. Not every woman or not every person or the vagina will get pregnant, but 100% of the time they'll go into menopause. And so we really want to help support the longevity of women's health and pelvic health to capture not just the pregnancy and postpartum piece of pelvic health, but also the perimenopause and postmenopause piece of pelvic health. This really needs to be a standard of practice for pelvic health PTs to always do an external pelvic assessment, to always do an internal pelvic assessment that is vaginal as well as rectal access to the pelvic floor. If your pelvic floor physical therapist is not doing an internal exam, they are missing really big pieces of what the whole picture can provide with having your symptoms. Okay, not everybody needs to do a Kegel. Look up my other podcast about that. But these are just terms that are starting to come out within the urology specialty as well as within the gynecology specialty, and just want to help spread the word that this is a much better, more encompassing terms for these symptoms, and that they are common, but not necessarily normal part of aging. And if you end up having multiple quote unquote recurrent or chronic UTIs, but not all of them were positive infection, but they still gave you an antibiotic, we are missing a massive piece of the picture with hormonal health that occurs within the pelvic region. So I just want to kind of pulse these things out there. I'm super excited to help spread the word, correct terminology, really more encompassing and inclusive terminology to really these symptoms within women's and pelvic health. All right, y'all, genitourinary syndrome of menopause, genitourinary syndrome of lactation. Know it, love it, use it, spread the word to your friends, right? Or share this podcast with those. And please feel free to comment, give me feedback, give me some questions so that way I can answer in a future podcast. Thank you so much for listening, and until next time.